Thank you, Beatrice, Dicky, Saurav, and all the partners who are here and then who could not join here today. I'd like to thank especially Dr. Elizabeth McGowan for her support for the EHIN and then the activities over the last 2 years. Maybe we can have a quick interaction with each of the partners. This journey of EHIN, which began 9 years ago, would not have been possible without this active support that we have received from various partners who are here to, some of them are here today and some of them could not join here today, but then this journey would not have been possible without your active support and uh, being with us. Maybe we can have a quick round of interaction, like starting with Saurav from GIZ. I would like to ask Saurav, is there any wish list that you have in mind that which AHIN can work together with GIC in the next 3 to 5 years? Is there anything specific, or you would like to suggest something that we can align with our strategic plan? Thank you. Over to you, Saurav.
With respect to the OpenIMIS community and AHIN, I think what we've done so far together has been really great, and we've really been able to establish a community of practice in the region, as well as contribute to the wider community of practice of OpenIMIS. So I think up till now, we've what we've done together has really worked, I think, to the benefit of both organizations. Looking forward, I think a lot more of the same. And as we've been also discussing, we would continue our support to AHIN from GIZ and from the OpenIMIS initiative.
Maybe I would like to request Derek Munene from WHO next.
Thanks, Jai. First of all, I'd like to thank the AHIN community for really sustaining such a network. In my previous days in Afro, I used to have communities that were members of this particular network, even though they were in the African region. So to just thanks to the leadership and to all the participants, one of our objectives in the global strategy is collaboration. And so digital health being quite pervasive and really cross-cutting, we really think that we can do more together than than all of us acting upon issues independent of each other. So collaboration and networking is some of the foundational pieces of our global strategy. In addition to that, we have realized that the issue of designing solutions is less complex as it was in the past. The key issues right now is data exchange, interoperability, governance, and ensuring that we're using these digital solutions appropriately at scale. And so some of the benefits we've gotten from partnerships like this one and others is the issue of co-creation of those public goods, such as the digital health public goods. IMIS that was presented by GIZ is one such example. We are producing a home for public global goods called the Digital Health Clearinghouse, which we intend to use as a home for member states to be able to access curated digital health solutions in pursuit of implementing their digital health strategies. And so partnership is key, because through partnerships, we're able to share lessons like was done with the previous speaker from Foundation Foundation Fiber. The issue of making sure that we are collectively pulling the same direction is very critical right now, especially given the pandemic situation we're in. So we're very pleased to be seeing networks like this to be, pulling in the direction of the global strategy. And at the same time, we really would like to ensure that we are, contributing, amplifying each other's efforts in pursuit of the global objectives that we all share. So these are the some summary points, Jay, I would like to share, and really to thank everybody, in particular you, Jay, for really making partnerships a reality, that, walking the talk of partnerships. Thanks a lot.
Thank you very much, Derek, for joining us amidst your busy schedule. It's very heartening to have you here, especially to share about the global digital health strategy of WHO and how countries can benefit from that. Thank you very much again. Now I'd like to request Vrinda Rathod from PAT.
Hi, everyone. thanks so much for having me, and thank you for putting this together. To kind of address your question, I think you heard Path is doing a great many things in digital health and trying to support kind of filling in a lot of these gaps that AHIN has identified in their call to action. One of the programs that I lead kind of comes to mind as a good fit or a good way for us to continue to work together. It's called the Digital Health Applied Leadership Program. And it came from this idea that the current approach for digital health transformation relies on existing institutional capacity without really making investments in leaders and practitioners that enable that digital transformation to occur. And I'm sure, as many of you might have experienced, this can lead to misalignment, poor coordination, and probably frustration on all of our parts when we're implementing these digital health solutions. So this program was designed with a 6-month consultation process and aims to address essentially the priorities for digital health leadership capacity strengthening. So through online courses, workshops, practical exercises, we're planning to help prepare a new cadre of digital health practitioners to guide digital transformation based in best practices. And so these individuals will be much better prepared to help manage digital health related projects, share experiences with a growing network of practitioners, and also just help support and develop national digital health strategies going forward. So we're really looking forward to participating with you all in that.
Thank you, Brinda. DHALP has been very exciting. In fact, I had the pleasure of working with Leslie Annie, Stephen, and Alice for the survey here in Asia as well. So as you can see from the initial Mentimeter poll, that there's a lot of interest for DHALP. So we are also eagerly looking forward for the rollout here in Asia. Thank you, Brinda.
Thank you.
Beatrice, next to you.
Thank you, Jay. Thank you, everybody. Yes, we've got this collaboration for 3 years now between the Pierre Fabre Foundation and AHIN, and it's been a very productive one. And we want to continue to try to collaborate, in 2 fields mainly, into academic training, because, as I said, I think this is one of the key solutions, to implement digital solutions for healthcare. And we want to train, sort of policymakers, but also implementers on the field. And we want also to support this training within university. In our program, especially in Asia, we have strong connections with universities in Vietnam, Thailand, and Laos, because we think we want to support them, because they are the key, to try to raise the level of education and expertise in one country. So this is one thing. And of course, the second thing is all the sharing that we can try to enhance within the different countries, and especially between Africa and Asia. We like to think that maybe we can try to have a better link between all what you're doing in Asia and what we're doing in Francophone Africa in particular, So I want also to take this opportunity to thank a lot AHIN, and particularly to thank Jay for his very important contribution to our observatory, and especially to our once a year event, our worldwide conference, where Jay has been able to help us, a very highly valuable contribution for this conference. And so thank you very much. I would like to add maybe also that we're interested into your convergence meeting in Laos, because we have a strong investment in Laos with the because we support, the training of pharmacists, the training of midwives. So we have strong link with the University of Laos. So maybe it's a way where we can join our efforts together as well to help this country, implement, a productive digital health policy. Thanks a lot.
Thanks a lot, Beatrice. Certainly, we would like to work together with the foundation as well as the Ministry of Health and other partners for the Convergence Workshop scheduled in Laos in a couple of months now. Thank you very much. I do see Paul Biondish the director of Global Health Informatics Program from Regenstrief. Paul, thanks for being here with us, and you have been a very long-standing supporter of AHIN. It's so delightful to have you here. Please do share how do you think that we can work together. Thank you, Paul.
Yeah, hi. Good morning, good afternoon, and good evening to everyone. I'm actually really honored to be with you all today, and it has been an absolute pleasure to have watched AHIN emerge into what is a very strong community of practice since many years ago. I think I was at some of the first meetings, and as the project lead of OpenHIE, I had the opportunity to review the AHIN call to action. In short, I believe that there's a continued significant opportunity for collaboration with AHIN. Specifically, OpenHIE's mission is to help countries recognize effective, sustainable information exchange. So the focus on governance standards and architecture within the call to action, it's very highly aligned with our efforts as a community. I was able to be on the call since early this morning, and to listen to the country experience session earlier this morning reinforces that collaboration from my perspective. For example, as I was listening to Myanmar move towards HIE use cases, that highly aligns with our community's move towards establishing what we're calling practice areas, which is really focused around operationalizing use cases within the HIE framework. You know, there's one thing to have a blueprint, there's another to take a bite of the elephant and to operationalize exchange through a concrete example like universal health coverage or supply chain management. So I hope this gives you an example that we're obviously very aligned as OpenHIE with AHIN, and as such, OpenHIE is willing to provide all of the resources, subject matter expertise, artifacts, and tools to AHIN members as our commitment to the AHIN network. An example of the artifacts that we're trying to produce in support of all of this work is our newly opened OpenHIE Academy, which I shared a link for in the chat. Inside that link are the first of what are hopefully a growing number of free online courses to help you all and for us to all learn together the concepts of health information exchange. Hopefully these will be useful to you all. And perhaps as AHIN and OpenHIE together, we can collaborate on further developing that academy going forward. Additionally, we recently established something called the OpenHIE Steering Committee. It's 100% comprised of health leaders from the countries that we intend to serve. And so it's very much country leaders that drive the agenda of OpenHIE. And I'm really happy to say that we consulted very early with leadership of AHIN during the formation of this committee, and I'm pleased to let you all know that we've placed multiple members based upon AHIN's recommendations into the steering committee. So I just wanted to maybe finalize by saying congratulations to AHIN on its progress as a community. And I hope that it comes across very clearly that we stand in solidarity alongside you all in the years to come. And we're very much looking forward to further collaboration with AHIN. And I'm just very humbled to have an opportunity to be with you all today and to witness the growth and the power and the strength of the community that you all have developed. Thanks.
Thanks a lot, Paul. We have taken note of the OpenHIE Academy, and then we would like to disseminate that with our membership very soon. Thank you.
Sure.
I hope I haven't missed any other partner who has joined us here for live interaction. In case if I have missed anyone, please let me know. Otherwise, I would like to ask Alvin and Dr. Bunchai if there is any final words for the partnership session, and then we'll move on to the next. Thank you.
Yeah, I'll go first, and then our chair to give the closing remarks. So thank you, everyone. AHIN is where we are right now because of your support. There's a lot of work ahead. Derek already showed the immensity of the work what we all need to do. I think WHO has laid out a good roadmap, and I think we should support that roadmap as much as we can. We know that we are challenged in our own countries. Our COVID cases are going up, going down, going up, going down. I really like what Dr. Faisul said in the opening part of the AHIN when he said that we are all in the same storm, but we are in different boats. So I think what AHIN is trying to do is to try to get all of these different boats to help each other. If you have a lifesaver in one boat and another boat needs it, then you send it. If you have sailors in one boat and you need to send sailors to another boat, then you share your sailors. But we all are in the same storm, and we are all suffering from the pandemic. So I think let's come together. AHIN is offering itself as a platform, and AHIN is basically us together in the call. I signed Dr. Eric Tayag and other members in the Working Council member. We hope that we can come together. There's the ASEAN eHealth Technical Working Group being chaired by the Philippines with Dr. Eric Tayag. So I think that's another group that we can support as well. And I hope to look forward to the activities. We will announce this on January 28th. We will be contacting you between now and January 28th to agree that this will be our aligned work for the next 3 to 5 years. And expect an email from us. Thank you, Jai. Thank you, everyone. And back to my boss, Dr. Bunchay.
I think we have 3 minutes, and I found that I think Jürgen is one of our, a partner for many years. Could you speak 1 or 2 minutes, please, Jürgen, or the IHE?
Jürgen. We also have, I see Klube and Garab, CP.
Okay.
Dr. Bunchay, I think we lost in between. So I think in case his mic is fine now, maybe he can have his closing remarks. Saurav, are you around?
Yeah. Can you hear me now?
Yes.
Okay.
Yes, Saurav. Please go
All
on.
right, perfect. And in the interest of time, I don't know when I got cut off before, but one announcement that I would also like to make from the OpenIMIS community is we continue working with AHIN, and in addition, we're establishing a catalytic implementation fund for future OpenIMIS implementations. And this fund would be available to help scheme operators and countries really get started with OpenIMIS. So if there are interests in the various countries represented now and in AHIN, please do get in touch. I think AHIN would be the best way to get in touch with us. We'll have more sessions in the coming days, weeks on this fund and how you can apply, but please do keep that in mind. And we look forward to having implementations. Thank you.
Thanks a lot, Saurav.
Okay, let me. I think I think we will not have today if we don't have our partner, the WHO, ADB foundations, several friends across the globe that work with us. We also encourage the developing partner to align. And we also country align what we think is the foundation of to moving digital health forward. So I don't know how to say that we don't imagine that we can be working 9 years and it seems like we are growing, and this is because of what we always said, that developing partner countries, we are friends, so we have the same direction and also the same passion to moving forward the digital health for the country, for the country that you want, the developing partner want to help. So thank you very much for all, and I think the time is up, and I don't forget to participate to the last day, next Thursday, 7 p.m. Manila time. Okay, thank you very much. Good night.
Thank you.
We'll take a picture first. Open.
Oh yeah, please open. Please open your.
Open already.
Wow, everyone's there. So between now and next week, we will be consolidating all of the inputs coming from our partners, and then we will map them to gaps, and then that will be the result of our synthesis. From 7 to 8, we will have the network of networks. These are networks from other regions, from Africa, South America, and Pacific Island countries. We will have an interaction with them and find out how we can help each other. We call that the network of networks. And then from 8 to 9 p.m. will be our synthesis. So please be there so that you can see how we think we can do the next 3-5 years together.